Sure. Let's dive deeper into various aspects of chronic obstructive pulmonary disease, including its pathophysiology, detailed treatment options, lifestyle adjustments, and ongoing research. COPD encompasses a group of lung diseases, primarily chronic bronchitis and emphysema. Chronic bronchitis is characterized by inflammation of the bronchial tubes, leading to increased mucus production and a persistent cough. The inflammation narrows the airways, which impairs airflow. Emphysema involves the destruction of the alveoli, the tiny air sacs in the lungs where gas exchange occurs. This leads to reduced surface area for oxygen absorption and carbon dioxide removal. The loss of elasticity in the alveoli makes it difficult to exhale air. Both conditions result in airflow obstruction, which is not fully reversible and progressively worsens over time. Chronic cough is often one of the first signs. It may be productive, producing mucus, or non-productive. Sputum production, where mucus may be thick and discolored, especially during exacerbations or infections. Dyspnea, or shortness of breath, initially occurs during exertion, but may progress to being experienced at rest. Fatigue, due to the increased energy expenditure needed for breathing. Cyanosis, a bluish color around the lips or fingertips indicating low oxygen levels, can be a sign of advanced disease. In addition to spirometry, other diagnostic tools can include high-resolution CT scans, which can provide detailed images of the lungs and help differentiate between COPD and other lung diseases. An alpha-1 antitrypsin level test to rule out genetic causes of COPD. The BODE index, a scoring system that assesses body mass index, obstruction measured by FEV1, dyspnea, and exercise capacity to predict mortality and health status. Let's talk about pharmacological treatments for COPD. First, we have bronchodilators. These are crucial for managing symptoms. Short-acting bronchodilators like albuterol are used for quick relief of symptoms. On the other hand, long-acting bronchodilators such as salmeterol and tiotropium are used for maintenance therapy. Next, we have inhaled corticosteroids. Medications like fluticasone can be added for patients, especially those who experience frequent exacerbations. Then there are combination inhalers. These combine bronchodilators and corticosteroids, making administration easier. For example, budesonide, formoterol, is a common combination. Phosphodiesterase 4 inhibitors like roflumilast are another option. This oral medication reduces inflammation and relaxes the airways. Finally, antibiotics are sometimes necessary, particularly for bacterial infections during exacerbations. Non-pharmacological treatments, pulmonary rehabilitation. A structured program that includes exercise training, nutritional counseling, and education about the disease. Benefits include improved physical endurance, decreased dyspnea, and improved quality of life. Oxygen therapy. For patients with severe COPD and low oxygen levels, long-term oxygen therapy can improve survival and quality of life. Vaccinations, annual flu vaccines and pneumococcal vaccines are recommended to prevent respiratory infections. Surgical options, lung volume, reduction surgery or BRS. This may be an option for patients with emphysema who are not responding to other treatments. It involves removing the most diseased parts of the lung to improve overall function. Lung transplant. For selected patients with very advanced disease, this can be a life-saving option. Adopting a healthier lifestyle can significantly influence the management of COPD. Smoking cessation, the most effective way to slow disease progression. Resources include counseling, nicotine replacement therapy, and medications like varenicline. Nutrition, maintaining a healthy weight can help reduce symptoms. High-protein diets may benefit those who are underweight. Avoiding large meals can also help reduce dyspnea during eating. Exercise, even mild to moderate physical activity, can improve lung function and overall health. Exercise programs should be tailored to the individual's capacity. Breathing techniques. Techniques like pursed lip breathing can help manage shortness of breath. Air quality control, using air filters, reducing allergens, and avoiding smoke and pollution can help improve lung health. Research into COPD is evolving, focusing on biomarkers, identifying biological markers to predict disease progression and response to treatment. Genetic studies, understanding the genetic basis of COPD, especially in patients with alpha-1 antitrypsin deficiency. New therapies investigating new medications, including biologics that target specific inflammatory pathways involved in COPD. Telemedicine, exploring remote monitoring and virtual care options to manage COPD more effectively, especially in underserved areas. Support and resources. Living with COPD can be challenging, and support is vital. Support groups. Connecting with others facing similar challenges can provide emotional support and practical tips. Educational resources. Organizations like the American Lung Association provide valuable information on managing COPD. Mental health support. Addressing anxiety and depression, which are common among COPD patients, through therapy or support group. COPD is a complex, multifactorial disease that requires comprehensive management tailored to the individual's needs. With appropriate treatment and lifestyle changes, many individuals with COPD can lead fulfilling lives. If you have further questions or need specific information, feel free to ask.